Now, which of the following would be the best way to confirm it is a factitious cause for her hypoglycemia? By mistake or intentionally, she has taken some insulin and it must be hypoglycemia. So, how to know that insulin is inside the body, it is formed from inside the body or outside the body? So, whenever C-peptide level is more than normal, it is always exogenous insulin. So, if there is a high C-peptide level, it simply means this is exogenous. If there is a high, if there is high insulin, if there is a high C-peptide in comparison to the insulin, simply it means it is coming from where? It is coming from outside. Because insulin is formed, if you remember the diagram, this is the normal diagram for pre-proinsulin. It is called as pre-proinsulin. It is having initial segment, it is having chain A, it is having chain B and C. Chain A, B and C. After that, when initial segment is gone, it becomes like this: chain A, chain B and C peptide, and it is called as proinsulin. Simply it is called as proinsulin. And when C peptide comes out and A and B chain are there, it is called as insulin. It is called as C-peptide. So normally amount of insulin is always equimolar to the C-peptide. So if it is coming from inside, C-peptide will be equal to the mole of insulin. But if there is a high C-peptide level, it is showing the factitious cause of hypoglycemia. So answer is A. Okay, answer is A. A 3-year-old boy is brought to emergency department by his parent after a 1-week history of non-bilious vomiting. What is the diagnosis? His parent report the child spit up after meal much more frequently than his older brother did at his age, and that vomiting sometimes seemed forceful.